Hi friends, this is Dr. Sumana, Professor of Microbiology at JSS Medical College and Hospital, Mysuru, located in South India. In today's session, I'll be taking you through various puzzles that will help you in rationally choosing antibiotics for the treatment of pyelonephritis or upper urinary tract infections. Now, in this slide, I will show you a diagram. First, I'll draw a diagram. This diagram represents two kidneys and you have the ureters. This is just a diagrammatic representation. Now, the puzzle for us is to draw the letters in this diagram. First letter is M. Then you have to show A and an inverted I and an inverted P, this is P, and then a letter E. Now how do we do this? Now by drawing two lines, here I represent M, and drawing a line across I represent A, putting a dot here I represent inverted I, and putting a line here I represent inverted P, and I take this M and rotate it anti-clockwise. So this will become E. So now I have represented. I'll show you with the laser pointer. So by drawing these two lines, I have represented M, and drawing a line across I have represented A, and a dot here would represent inverted I, a line here would represent an inverted P, and this M taken and rotated anti-clockwise for 90 degrees, this will form one E. So this is MAIPE. Now what I'll do is I'll rearrange all these letters and derive the word A, I, M, aim, then the inverted P and E. Aim P. Now what is this aim P? You all know that aim of our kidneys is to generate the P. So like that you can remember the mnemonic aim P. These represent the first letters of the antibiotics useful in the treatment of pyelonephritis or upper urinary tract infection. These antibiotics are the recommendations as empirical drugs of choice as per the latest ICMR guideline. I'll expand this mnemonic. A represents amikacin, I represents imipenem, M represents meropenem, this P represents piperacillin tazobactam, and E represents ertapenem. So these are the empirical choices of antibiotics that can be chosen for the treatment of upper urinary tract infections, and then based on the culture sensitivity report, you may de-escalate or escalate. Now, I have given you the names of the antibiotics useful in the treatment of or empirical treatment of pyelonephritis. And next puzzle is the number puzzle or fun with numbers. Now, I'm going to give you the dosage of various antimicrobials useful in the treatment of pyelonephritis. And making use of these clues, you have to fill up this table. Here the first column says the antibiotics and then dosage and the number of times per day and the duration. So let me give you the dosages of antibiotics. Like amikacin is used at 15 milligram per kg once a day, and then based on the creatinine clearance. Then imipenem, meropenem are used at 1 gram thrice daily or 8 hourly, while piperacillin tazobactam is used at a dose of 4.5 grams 8 hourly. Ertapenem is used at a dose of 1 gram once a day, and uncomplicated cystitis is treated for 7 to 10 days, and uncomplicated pyelonephritis is treated for 7 to 10 days, and complicated pyelonephritis is treated for 10 to 15 days. Now fill the table using only numbers 1, 2, 3, 4 and 5 only. So now let us see how we can do it. Now here amikacin is represented as 15. Sorry, I have to take the pen. So here I represent amikacin as 1, 5 because you're using 1 and 5 because you're supposed to use numbers 1, 2, 3, 4 and 5 only, or you can also write it as 3 into 5 to represent 15. And then number of times per day, this is just single dose on day 1. Irrespective of the creatinine clearance, the loading dose is given at 15 milligram per kg body weight to reduce the nephrotoxicity. And uncomplicated cystitis is treated for 7 to 10 days. How do we represent 7? 5 plus 2. 5 into 2, that will be 10. So 7 to 10 days. While complicated pyelonephritis is treated for 10 to 15 days. 5 into 2 to 5 into 3. So that represents 10 to 15 days. Now imipenem 1 gram, number of times 8 hourly would be 3 times. Same thing, uncomplicated would be for 7 to 10 days and complicated pyelonephritis would be 10 to 15 days. Meropenem 1 gram 3 times a day, same duration. Piperacillin tazobactam 4.5, we use it unchanged. And this also is given 8 hourly, so 3 times a day, and the duration is the same. Ertapenem 1 gram just once, and duration is the same. So using this simple mathematical puzzles, what I try to reiterate is that choice of appropriate antibiotic in appropriate dose given for appropriate duration constitutes to rational use of antimicrobials or antibiotics. So solving this simple mathematical puzzle, you will be able to remember. Aminoglycosides have nephrotoxicity. Gentamicin and amikacin may be used in uncomplicated pyelonephritis, while amikacin can be used in complicated pyelonephritis. Compared to gentamicin, amikacin is more kidney friendly. It's only a comparative term. Now, I want to give you additional pearls of wisdom. How do we treat acute prostatitis? Now, acute prostatitis can be treated with these antibiotics empirically, that is P times. P times is painful times. We all know that prostatitis results in severe pain, especially the pelvic pain and the lower abdominal pain. So remember this mnemonic P times or painful times. So P represents piperacillin tazobactam, T is trimethoprim, S is sulfamethoxazole, together they constitute cotrimoxazole. I would be imipenem, M is meropenem, and E is ertapenem. So P times is the mnemonic for empirical choice of antimicrobials in acute prostatitis. Now coming to epididymoorchitis, it's usually caused by the sexually transmitted pathogens. So the mnemonic here is cold. C represents ceftriaxone, O is ofloxacin, L is levofloxacin, and D is doxycycline. Now, cold, how do we remember this? You all know that during the cold season, the testicles retreat up towards the abdomen. So that's why you can remember this mnemonic cold. Expanding ceftriaxone, ofloxacin, levofloxacin, and doxycycline. Now, I have another puzzle called Drop the Dropout to the Pandora. Till now, I have been telling you the various choice of antibiotics that can be used empirically. And when you are treating especially the upper urinary tract infection, it's mandatory to send the urine sample for culture and then start the patient on empirical antibiotics. And once you have the culture sensitivity report in your hand, based on the sensitivity, you may escalate or de-escalate. Here in this puzzle, what I would want you to know is certain antibiotics cannot be used in urinary tract infection. What are those antibiotics? Especially those which are metabolized in the liver and excreted in the inactive form in the urinary tract, or some of the antibiotics which are toxic to the kidney cannot be used. So to remember this, I have created a story for you. The story goes like this. An assistant commissioner of police or ACP to represent acute pyelonephritis has features of recurrent urinary tract infections. He self-medicates himself with various antibiotics, referring to the various prescriptions given to him by the doctor for respiratory infections or some other infections. He is not relieved of the symptoms. He has no time to go to the doctor. He visits the Google for higher antibiotics. Again, self-medicates, but no relief. So what he decides? He says, okay, let me go to TTD. So he came to TTD, is Tirupati Tirumala Devasthanam, to get relieved of his P symptoms, the urinary symptoms, through the blessings of Lord Venkateshwara. He is waiting in the queue for darshan. There again, he develops features of urgency and frequency of micturition. Despite all these measures, is not relieved of the symptoms. Why? Why? Because he has taken some antibiotics which are not working on the urinary tract infections. What are those antibiotics? So the clue lies in these block letters or capital letters that I have represented here. This is came to TTD for P symptoms. So these are the antibiotics which cannot be used in urinary tract infection. Let us see. Now what I'll do is I'll give you a host of antibiotics. They're distributed into 4 boxes: A, B, C and D. So these are the antibiotics. I've given you the host, but I've already given you the clue. What can be given, what cannot be given. Now let us see whether we can use the following antibiotics or not. Amikacin, yes, you can use. Ciprofloxacin, quinolone, you can use. Azithromycin, which is a macrolide which is inactivated in the liver, metabolized in the liver, cannot be used. Piperacillin tazobactam, yes. Amoxiclav, yes. Gentamicin, yes. Erythromycin, no. Again a macrolide which is metabolized in the liver. Cefatoxime as cephalosporin, 3rd generation, yes. Cefuroxime, 2nd generation cephalosporin. If the urine culture sensitivity report shows that it is sensitive to cefuroxime, yes, you can use cefuroxime. Cefoperazone sulbactam, yes, you can use. Tigecycline, no. This is also excreted in the inactive form. So in TTD, came to TTD, one of the T is represented by tigecycline. Then clarithromycin, the C in came to TTD, is a macrolide which cannot be used in the treatment of urinary tract infection. Cholistimethate, yes, you can use. Of course, cholistimethate also is nephrotoxic, But compared to polymyxin B, this is a better drug. Now, ofloxacin, yes, which is a quinolone, you can use. Cefixime, a fourth generation cephalosporin, yes, you can use. Linezolid, yes, if you have gram-positive infections like the enterococcal infection. Then polymyxin B, I told you, came to TTD for P symptoms. So the P is represented by polymyxin B. Meropenem, yes, a carbapenem. Imipenem, yes. Ceftriaxone, yes. And minocycline. Min came is minocycline. It cannot be used. Then levofloxacin is a quinolone. Yes, you can use. Amoxiclav, yes. And vancomycin, yes, a patient with gram-positive infection of the urinary tract, sensitive only to vancomycin. In the severe stage of sepsis, say urosepsis, you may use vancomycin. Next, we'll see what is there in box D. Cotrimoxazole, of course, yes. Nitrofurantoin, yes, but only in the lower urinary tract infection. Fosfomycin, yes, again lower UTI. Tetracycline, one more T in TTD is represented by tetracycline. So tetracycline cannot be used. Amikacin, yes, you can use an aminoglycoside. Again, based on the creatinine clearance, you use it. Doxycycline, so came to TTD, D is represented by doxycycline. So you can't use doxycycline. Plazomycin is an aminoglycoside, yes, you can use. And teicoplanin, glycopeptide for gram-positive infections, you can use. Teicoplanin is more renal friendly than vancomycin. So these are the antibiotics that cannot be used in urinary tract infection. Now let us see what are these antibiotics put into or pushed into this Pandora box. So we have azithromycin. Let me just say, take the mnemonic came to TTD. C is clarithromycin, A is azithromycin, M is minocycline, E is erythromycin, then one T is tetracycline, another T is tigecycline, D is doxycycline, and then to get relieved of the P symptoms, the P is polymyxin B here. So these are the antibiotics pushed into the Pandora box. So push to the Pandora is the name of the game. Now, additional pearls of wisdom that I would want to give you. In complicated urinary tract infection and acute pyelonephritis in children, it is best treated with amikacin single dose for few days till the patient can take orally. Now, so UTI is treated with amikacin single dose, complicated UTI. Now for cystitis, we can use amoxicillin or nitrofurantoin. I've combined all these letters C, A and N formed a mnemonic called CAN. This is a CAN. Now if you have the end-on appearance of this CAN, it looks like a bladder and the urethra. So this represents cystitis, the bladder. So cystitis in children, remember the mnemonic CAN. C is cystitis, A is amoxicillin, and N is nitrofurantoin. Now for prophylaxis of vesico-ureteric reflux, which is one of the commonest congenital disorder of the urinary tract resulting in the vesico-ureteric reflux. So to prevent the urinary tract infection in these children till it is being repaired, we need to use certain antibiotics. What are these antibiotics? Nitrofurantoin and cotrimoxazole. Now the puzzle here again, using this diagram, draw a line to represent N and identify the letters C and O. Let us see how we do this. See here, so just one line, this will represent N and this represents C and O. So con, CO is cotrimoxazole and N is nitrofurantoin. So single doses of these drugs based on the weight of the baby You use cotrimoxazole or nitrofurantoin at bedtime to prevent cystitis and to prevent the use of amoxicillin for treatment and preventing the use of nitrofurantoin for the treatment. So con prevents can. Can is cystitis, amoxicillin and nitrofurantoin. I have already told you that. So remember, for bedtime prophylaxis, preventing urinary tract infection in children who have a psychoureteric reflux, you use cotrimoxazole and nitrofurantoin. Thank you friends for viewing this video. Please like, share and subscribe to my YouTube channel.